If you're Chinese or Bidayo, aged between 30 and 60, or if you know someone in this group, please take just 1 minute to watch this video. Hey, nothing racist, but it might save a life. Hi, I'm Dr. Nina, a clinical oncologist. You might have heard of Datuk Lee Chong Wei. He was diagnosed with NPC or Nasalpharyngeal cancer back in 2018. It hits close to home, doesn't it? NPC is a very sneaky nose cancer because the symptoms are subtle in the very early stage. Abnormal cells start growing at the upper part of your throat right behind your nose, forming tumors that can spread to the lymph nodes, liver, lungs, and bones. You might notice a painless lump in your neck, some nosebleeds or nose blocks that you brush off. Many people don't think twice about the signs. They think it's common. It's nothing serious. It's not painful. And hence, don't get checked. I get it. Life is busy. But this is where awareness really matters. The ethnic link to NPC is undeniable. The highest incidence rates were reported among the Bidayo population in Sarawak, and it ranks among the highest in the world. We also see a very high incidence of NPC among the Chinese ethnicity in Malaysia, Singapore, as well as China. Food like salted fish, cured meats, preserved veg, these common food in Chinese diets are loaded with nitrites and nitrates that can mess with our DNA, leading to cancer, especially NPC. Next up is the Epstein-Barr virus or EBV, which has been consistently linked to NPC. While EBV is harmless and we do get infected, it's the EBV infection together with genetic predisposition which increase risk of NPC in our population. Smoking, vaping, and tobacco use are also major contributors to the risk. A recent study shows that smoking can significantly increase the long-term risk of this cancer, partly by reactivating EBV in your body. And if you are in a work environment with long-term exposure to wood, dust, or formaldehyde, that's another risk factor to keep in mind. But here's the good news. If we catch NPC early, it's very treatable. Radiotherapy instead of surgery is the curative treatment for NPC. The survival rates for the earliest stages, stage 1 or 2, can be as high as 85% up to 90%. I have personally seen patients go on to live well over many years after their diagnosis. Hey, Datuk Lee Chong Wei is a good example of NPC detected and treated early. Remember, don't ignore the warning signs. If you notice any symptoms indicative of NPC, such as recurring nosebleed, nasal congestion, or neck swelling, visit an ENT specialist and get your nasal endoscope done. Share this video, educate your friends and family. We're all in this together. Early detection saves lives. Make sure we're looking out for each other.